little bit physics of ultrasound. I'll tell you again, teach you again, physics of ultrasound, because physics also is very important for us, right? Because what is the frequency of the probe? You're familiar with the frequency of the probe. So the frequency of the probe, earlier the probes used to come, TVS probes used to 5 to 6 megahertz only. But now with the modern technology, where you want to have very good in-depth knowledge about the follicular situation or any gynae pathology, we have to have high frequency probes. High frequency, now we are even going up to 9, 11, 12 also. So, but it is inversely proportional. The higher the frequency you have, now you'll have a very good resolution. Resolution means, very clear picture you'll have. Something which appearing hazy will no more appear hazy. But you will lose in the length. How much you can go, you will lose that area. Supposing you want to scan something which is far away in the pelvis, if you use a high frequency probe, you will not be able to do it. That I will practically also demonstrate to you. But, if you have a lower frequency, then you can see everything there, but the clarity will be less. Am I clear about that? Yeah. So, in between, you have to compromise something. Like not 5 or 6, not 12. In between, if you go to a frequency of 7 to 9, when I bought my first machine, color Doppler and ultrasound, it used to have fixed frequency. We have to tell 6.5, only one probe that you will get. It is very expensive also at that time. And that will be fixed frequency. You can't change the frequency. But now the latest machines which have come now, last 10 years, with a button you can change the frequency. Is it clear? Like supposing something you can't see, then you change the frequency. Yeah. So that advantage we have. So I will show you the probe. And the total length of the probe is around 40 centimeters like that. That is all the shape and the length, etc. And you have a needle guide which I will show you. Now can you see the probe there? Yes. Yeah. That is the transvaginal probe. It is nowadays very sleek probe, very sleek and very slender, very slender. So earlier we used to have big probes, and the probe used to be the crystal in the front of the probe. You all know how ultrasound works, no? It is piezoelectrical crystals. Yeah. Piezoelectrical crystals, they vibrate and then they produce a sound which is an ultrasound which can't be heard by our ears. That is called as an ultrasound. So then that has got a what we call the capability of going inside the tissues, penetrating the tissues, and producing the image for you on the screen. So that is the basic physics. I will tell you more about the physics also. But that is the basic physics. So now gone are the days, where you have a very big probe which is very uncomfortable for the patient in the vagina and all. Now you have very sleek probes and very good frequency probes. So, and below what you see there, those are the biopsy adapters. You understand why we should have biopsy adapter? Because directly we cannot go, This will guide us to go. The biopsy adapter will go and get fixed onto the probe, I will show you. And then the needle will pass through that. So you're very safe. You're very safe when you're doing an ovum pickup, because where the needle is going, you're able to see the needle. And the needle will also have, what is called as a eco-dense tip. They are putting some substance in the, some kind of a metallic substance in the tip of the needle, which will be visible to you on the ultrasound. That we want, because somewhere we should not go near the vessel or near some organ like intestine, etc., bladder, rectum, without knowing there. So that is the thing, to make the tip of the needle eco-dense or visible in the ultrasound. So that also I will show you how the needle looks. This is the aspiration needle. This is a single human needle we use in our hospital. Most of the centers use this because the diameter is very small. It is 17 gauge. Yeah. So 17 gauge is very good to get the egg inside the human, and then without damaging the outer layers of the egg also, we should not damage. And some people, in some centers will use a flushing needle. Flushing means, here, like once your learning curve of the ovum pickup has become good, like you have done hundreds of pickups, over the years, then you don't need all those techniques like, you go into one follicle, aspirate the follicle, and then still you are doubtful whether the egg has come or not. Because egg cannot be seen with the naked eye. Only the embryologist will tell us the egg has come or not. So, some people call it double lumen. Double lumen means, they used to flush out the follicle again with some media which doesn't damage the egg. And then again they used to aspirate. So that used to become very cumbersome, and the procedure which takes 10-15 minutes now, you'll see when she does that. That used to become 1 hour, 1.5 hours. So, unnecessarily, and the egg numbers also did not increase. Supposing you got 20 eggs by this technique, you may get 21 eggs by that technique. 21 or 20. Only 1 or 2 extra eggs. So, for that we need not do, the double lumen technique. Single lumen technique, if you want to learn also, it is very easy. Single lumen technique, if you want to learn, it's very easy. Then the companies from which we get is Gynetics, different sizes, and it will be a bit flexible. And double lumen, as I told you, double lumen we are not using. Some centers want to use, but we don't use. Double lumen is this. Can you see the double lumen?
Yes.
Yeah. So double lumen we are not using. Don't worry about that. Please get me some time to net. I will give you all this in
Yes.
We will give you all these on
yeah.
pen drive. Yeah.
We'll give you on a pen drive. Huh? So
Okay.
yeah. Like other characters are the sharpness. Sharpness means the needle has to be very sharp. Like it has to compensate between two things. It has to be sharp enough to go inside the follicle and get the egg, but not that sharp enough to as if cut the ovary or cut the follicle. So both the sides we have to be keep. The company from which we buy the needles. Sometimes we get some companies which are selling it at a lesser rate, but then we should buy